Hi there. My name is Dr. Nikki Jones-Stockery from Children's Treatment Network. I want to explain the use of constraint-induced movement therapy for children with cerebral palsy or acquired brain injury when one hand and arm is much weaker than the other. Some children with cerebral palsy or acquired brain injury have one hand and arm that functions much better than the other. The affected hand is weak, may have tight muscle tone, poor muscle coordination, and often has involuntary posturing movements. Everyday activities are usually more difficult to perform. Some people call the affected hand the helper hand. In constraint-induced movement therapy, the less affected or uninvolved hand and arm is placed in a constraint and restrained over a period of time. This can be done continuously or intermittently over days to weeks. Some types of constraints include a fiberglass cast or a removable splint, sock, or mitt. The constraint prevents the individual from using their dominant hand and arm. This encourages them to use their affected hand by doing hand training exercises. The goal of constraint is to improve the use of the affected hand and increase use of both hands together. Constraint has been shown in well-performed research studies to improve function and increase use of the affected hand and arm. A good home program is set up in consultation with an occupational therapist and usually consists of at least 1 hour a day of direct hand training, including strength and movement exercises and activities. Sometimes day camps are organized so children can participate in fun activities together and see that other children have similar challenges. Children are encouraged to use the constraint at home and in the community to integrate their affected hand and arm into their daily routines and activities. Ideally, they should use the constraint while participating in tasks and activities that are important to them to help build skills that lead to independence. For more information, talk to your occupational therapist or spasticity management clinic team member.